What is streptococcal toxic shock syndrome and why is it causing concern? This question is reverberating across the globe as the world grapples with a surge in cases of this dangerous disease. Streptococcal toxic shock syndrome, or STSS, is a severe bacterial infection caused by Group A Streptococcus. The recent rise of STSS cases, particularly in the UK, has sparked grave concern among health professionals and the public alike. This worrying trend has cast a spotlight on STSS, bringing it to the forefront of our collective consciousness. The disease has already claimed lives, and the increasing number of cases is a stark reminder of the ever-present threat of infectious diseases. But what exactly is STSS? How does it affect the human body and who is most at risk? These are some of the questions we will explore as we delve into the world of STSS. As we delve deeper, we will uncover the symptoms of this condition, who is most affected, and the current state of treatment and prevention. So brace yourself for a journey into the complex and intriguing world of streptococcal toxic shock syndrome. To fully understand streptococcal toxic shock syndrome, we must first understand its cause. At the heart of this syndrome is a bacterium known as Group A Streptococcus, or Strep A for short. This bacterium is a common resident in our environment, often living harmlessly in our throats and on our skin. However, under certain conditions, it can become an unwelcome guest, causing a range of illnesses. Now, Strep A is not a one-trick pony. It has an extensive repertoire of diseases it can cause. From minor skin infections and throat infections, often known as strep throat, it can escalate to more severe conditions. Scarlet fever, a disease that may sound like it belongs in a 19th century novel, is one of them. This illness manifests as a bright red rash, high fever, and sore throat, and it's caused by toxins produced by some strains of Strep A. Another severe complication is rheumatic heart disease. This can occur after repeated or severe episodes of strep throat when the body's immune response mistakenly attacks the heart valves. It's a serious condition that can lead to long-term heart damage. And then we have streptococcal toxic shock syndrome, the focus of our discussion. This is a rare but severe condition caused by toxins produced by Strep A. The toxins trigger a sudden drop in blood pressure, which can deprive organs of oxygen and lead to multi-organ failure, a life-threatening situation. Strep A is a master of disguise, capable of causing a variety of illnesses. Yet it's the same culprit behind all these diverse conditions. The difference lies in how our bodies respond to the bacterium and the toxins it produces. This response is influenced by various factors, including our immune system, general health, and possibly even our genetic makeup. Now that we understand the cause, let's move on to the symptoms of streptococcal toxic shock syndrome. The symptoms of streptococcal toxic shock syndrome can be severe and life-threatening. Streptococcal toxic shock syndrome, or STSS, is a grave illness that can progress rapidly. The initial symptoms may appear similar to other common infections, which can make it difficult to diagnose early on. However, the severity and quick progression of these symptoms set STSS apart. The earliest symptoms can include a high fever and chills, akin to the flu. You might also experience severe pain or discomfort in an area of the body, usually where the infection began. This could be a wound, a surgical site, or even the throat if the infection originated from a case of strep throat. As the infection progresses, other symptoms can emerge. These include dizziness, confusion, or disorientation, which are signs that the infection is spreading and affecting the body systemically. Acute pain might also escalate, along with a rapid heartbeat, also known as tachycardia. The skin might develop a rash, often flat, red, and widespread, which can later turn into dark, damaged patches as the disease advances. One of the most alarming symptoms of STSS is a drop in blood pressure, leading to shock. This is a critical condition where the body's organs do not receive enough blood flow. Shock can cause multiple organ failure and is life-threatening. Other symptoms can include nausea, vomiting, and diarrhea, as well as muscle aches and pains. Some people may also develop redness, swelling, or other signs of infection around a surgical wound or skin injury. It's crucial to remember that STSS can progress incredibly quickly, sometimes in a matter of hours. If you or someone you know experiences a combination of these symptoms, particularly following a wound or surgery, it's important to seek medical attention immediately. Recognizing these symptoms early is crucial for effective treatment. While anyone can contract a Group A Streptococcus infection, Certain populations are more vulnerable to developing streptococcal toxic shock syndrome. Streptococcal toxic shock syndrome, or STSS, is a severe and life-threatening condition that can occur in people of all ages and backgrounds. However, it's important to recognize that some populations are more susceptible than others. Children, particularly those under the age of 5, are one of the groups most at risk. Their immune systems are still developing, which can make them more susceptible to infections. In fact, a recent surge of Group A streptococcal infections in the UK resulted in numerous child fatalities, underscoring the vulnerability of this age group. The elderly also face a higher risk. As we age, our immune systems naturally weaken, making it harder for our bodies to fight off infections. Older individuals may also have underlying health conditions that can further compromise their immune system, increasing their susceptibility to STSS. Additionally, people with compromised immune systems are at a heightened risk. This can include those living with conditions like HIV or AIDS, individuals undergoing cancer treatment such as chemotherapy, or those taking certain medications that weaken the immune system. Those with chronic illnesses such as diabetes, heart disease, or lung disease are also more susceptible. These conditions can make it harder for the body to fight off infections, increasing the likelihood of complications like STSS. Lastly, those with skin wounds or burns are more at risk. Group A Streptococcus bacteria, the kind that can lead to STSS, often enter the body through broken skin. This means that individuals with these conditions have a higher chance of contracting a Group A Streptococcus infection. Understanding who is most at risk can help in prevention and early detection of this severe condition. It's crucial for these high-risk groups and those who care for them to be vigilant about potential symptoms and to seek medical attention promptly if STSS is suspected. Treatment for streptococcal toxic shock syndrome can be challenging, but there are options available. When it comes to combating Group A streptococcal infections, antibiotics serve as our primary weapon. They've proven effective in treating Strep A, the bacteria responsible for streptococcal toxic shock syndrome. However, dealing with this syndrome is a different ballgame. The severity of the infection and the rapid progression of symptoms often complicate treatment, requiring immediate and aggressive medical intervention. Patients typically receive high-dose antibiotics alongside supportive care in an intensive care setting. This care often includes measures to stabilize blood pressure, manage organ dysfunction, and in some cases, surgical intervention to control the source of the infection. Despite these treatment options, prevention remains the ultimate goal. But this is where we hit a snag. As of now, there is no commercially available vaccine to prevent streptococcal toxic shock syndrome. A vaccine would be a game changer, offering a proactive approach to fend off this potentially life-threatening condition. So why don't we have a vaccine yet? It's not for a lack of trying. Various research groups are striving to develop a vaccine, with some candidates already in early-stage trials. But vaccine development is a complex and costly process. It involves numerous challenges, from understanding the biology of the bacteria to ensuring the vaccine's safety and effectiveness. Financial support is also a significant factor, and lack of it has hindered progress. But rest assured, the efforts continue. Every day, scientists are working tirelessly to unlock the secrets of Strep A and pave the way towards a vaccine. While the search for a vaccine continues, understanding and awareness of streptococcal toxic shock syndrome remains our best defense. Today, we've taken a deep dive into the alarming world of streptococcal toxic shock syndrome. We've explored what this condition is: a severe infection caused by Group A streptococcal bacteria, often leading to a rapid drop in blood pressure and organ failure. We've highlighted the key symptoms to look out for, which can include fever, dizziness, confusion, and a rash that can appear like sunburn. We've also shed light on the groups most vulnerable to this condition. While it can affect anyone, it's particularly severe in those with immune systems, the elderly, and in some cases, children. Turning our attention to treatment and prevention, we've underscored that while antibiotics can treat Strep A infections, there is currently no available vaccine. However, hope is on the horizon, with several vaccines in early-stage trials. By staying informed and vigilant, can all play a part in combating this severe and concerning condition. If you found video informative and helpful, please hit the like button and subscribe to our channel for more health-related content.